So DHA, EPA are generally the omega-3s that you would get in fish oil supplements or supplements, omega-3 supplements. And that is basically for cholesterol. And you can get it naturally from things like fish and algae and seaweed. And generally speaking, it is better to get nutrients from food because you absorb it. Most people will absorb it better than from supplements. But if you're not able to, the supplement is there. As far as the studies go, it has been shown pretty consistently to lower triglycerides, but the studies have been mixed about HDL, that's your good cholesterol, whether it helps or not, as well as LDL. Some studies have showed that it actually would make your LDL cholesterol worse. If that happens, you should definitely stop taking it. And some studies show that it would improve or lower your LDL cholesterol. And so that's why usually if you ask doctors or cardiologists or your primary care providers, the feelings are mixed about fish oil because in some people it has been shown to make their LDL cholesterol worse. And I would guess that it probably has to do with gut microbiome and how people absorb different things. But that is definitely something to monitor. Now, are also studies showing that, in people with high triglycerides, it helps improve their triglycerides as well as it can decrease their risk of cardiovascular events. So, forming cholesterol blockages that cause them to have heart attacks and so on. And so there is also a prescription form of omega-3s, and that's Lovaza. That's the brand name. Whether or not your insurance company pays for it, it's pretty mixed. It depends on what your insurance is and what your indication is. For a lot of people, the fish oil or omega-3s over the counter may be more cost effective, although it may not work as well because the FDA regulates prescription medications but not supplements. And so the prescription version may work better, but you may not be paid for. And so that's why you may try the supplement instead. And so the dosing that's been, studied with Lovaza, which, because it's coming from a pharmaceutical company, has been studied a lot, is 4 grams. That's the maximum dosing. And that the Lovaza has 1,500 milligrams of DHA and 1,680 milligrams of EPA. But generally, the effective dosing is thought to be anywhere from 2 grams to 4 grams. And so you need to look at the bottle if you're getting the supplement to see what the amount is. But the total amount of DHA and EPA together should be anywhere from 2 grams to 4 grams. That's generally thought to be the effective amount to lower your triglycerides and hopefully help your other cholesterol numbers as well. As far as the side effects, like we talked about, it could make your LDL cholesterol worse. Normally, though, the side effects are gastrointestinal, and then as well as most cholesterol medications and supplements can potentially impact your liver. And so that's also something you have to monitor and discuss, definitely discuss with your primary care provider as far as other medication interactions, other supplement interactions, and getting your blood work checked. Normally, you want to get your blood work, so that includes your cholesterol and liver enzymes and so on, checked at the beginning, and then try it for 3 to 6 months, and then get your blood work checked again to make sure you're not having any of those side effects.